Welcome and thank you for joining us for today's webinar on using practice data to achieve excellence. In the spirit of reconciliation, PracticeHub acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. Thank you for joining us for the latest PracticeHub webinar. We have had yet another overwhelming response to this webinar, so clearly it's a topic of much interest. And we have a great panel with us this afternoon who will be addressing some of the many questions which have come through during registration, which we thank you for. On our panel this afternoon, we have Chris Smeed, co-founder and CEO of Brisbane-based software startup Cubiko, an innovative platform dedicated to helping general practices gain insights into their business. Joining Chris, we have David Williams, a practicing neurologist and the managing director at HoxtonMPM, which designs scalable and efficient administration processes for medical practices. He draws upon his experience when helping practices recruit successfully. And Anna Maria Gibb, the co-creator of My Practice Manual, now PracticeHub. Anna Maria has a background in practice management and qualifications in business and adult education. I will now hand over to you, Anna Maria.
Fantastic. Thanks, Katrina, and good afternoon and welcome to everyone who is joining us this afternoon. And a special welcome to our presenters today, Chris Smeed from Cubiko and David Williams. Very excited to have both of you here to talk about this topic because I've noticed that it is a real topic of great interest and can be a great benefit to practices being able to manage and understand and use their data. So a quick overview before I hand over. So today we'll be talking about key metrics, focusing on things like patient billing, staffing ratios and overheads, opportunities for improvements, and benchmarking and measuring your progress. All right, Chris, I'm going to allow you to share your screen and take over from here.
Awesome. Well, I'm so excited to be presenting today. We used PracticeHub in our clinic and I always came to these webinars and I'm kind of like on the other side of the curtain today to be presenting. So that's like pretty exciting, a bit nerve-wracking. And also on my 7th day of quarantine from catching COVID. So if I do cough or splutter along the way, apologies in advance. As mentioned, my name is Chris. I used to be a practice manager. Now I work with 27 amazing people producing awesome data insights for general practice. We're talking about quality improvement and achieving excellence today. And I love thinking about that as if we're climbing the stairs. And this is meant to be a staircase. If you don't like my artwork, it's a staircase. And we're climbing the stairs. So we do something and we go up the stairs and we get something done and we achieve some excellence and then we stop and we regroup and we see how we're going. But to climb those stairs, we need to know where we're at. So suddenly that staircase can actually become a beautiful line graph. I don't know about you guys, but to me, that beautiful line graph might be a graph of practice manager stress over the last 24 months. So think about the steps, and to go up those steps, we need to know where we're starting from. So when we're putting today's webinar together, the question I got is, Chris, what are some of the key metrics we should be tracking in our clinic? So I thought we'd start there. So we have a base so we can know where we can improve from. We're going to start off by looking at the key metrics practices are tracking. If you're using Cubiko, this is a page you're going to find in Cubiko called your practice summary. So your practice summary page. We're going to break down some of those key metrics now and then talk about some quality improvements to achieving excellence from them. So we start off, and look, originally I was an accountant, so don't hold that against me. We start off by looking at what we're billing. So what are we billing as a clinic? Now, $42,601. Is that good or is that bad? Hey, David, I know you're on the line with me now. Do many of the clinics you work with set a goal or a budget or a target for what they want to bill, maybe each month or each week?
Yeah, well, one of the reasons that we get asked to come and consult in practices is because they don't have a strategy, a pathway, or a budget. So it's pretty common. I wouldn't be surprised if a few people on this call don't have an established strategy or budget. We see it as a roadmap forward. So we always work with practices to try and get a budget. It's really important.
Yeah. Mate, I know when I was running my clinic, I had those like sleepless nights when you're like, how are we going? Because you might only get a report from the accountant at like the end of the year. So having a goal or a target for what you're going to bill and seeing how you're going against that target is the best way to get that near real-time feedback about how you're going. So we encourage clinics to track their billings, so their gross billings, how they're going against their target or their budget, but also that year-on-year comparison, because oftentimes that can give you some real color as to how you're going with your billings. Now, next to tracking your billings, it's not all about the money, is the throughput. So we love to track the total unique patients your doctors have seen, but also really, really important to track the number of appointments that are going in your clinic and the number of people who are seeing non-GPs in your clinic. You know why? That makes a lot of work for your reception team. You need to look at that balanced view of that throughput in your reception area of how many patients are coming through. Next to that, wait time. I know it's not just for Google reviews, wait time. Probably not many clinics that can't say there isn't a Google review out there saying, I waited for 17 minutes for this. We were really lucky. We've had over 300 clinics opt into our national benchmarks. The average benchmark wait time in the country is about 10 minutes. So if you're seeing it less than 10 minutes for your wait time, you're doing really, really well. Next to that, bulk billing. I think there are so many chats right now about the transition from bulk billing to mixed billing. Keeping an eye on that. Now, you might notice that last week for wait time and bulk billing, I don't have a target, but I've got how we went compared to last week, which is giving you some real-time information about how you're going compared to the previous week. Once again, so you could know, was 5.9 minutes good or bad? It's good because the week before it was 9.2 minutes. Below that, we love to look at time. And I don't know about you guys, I don't know about you, about David and Anna Maria, but I found all the diaries, all the columns in our diaries, all the people. Sometimes it just feels like our diaries are full or not full when you look back a month. We love looking at it in total. So looking here, the purple is when your nurses or doctors are with patients. Your green is when they had things in their diary that didn't involve patients. So there might be restocking rooms, there might be meetings, there might be teaching, and the blue is available time. So we break that down in a bit more detail. And we're going to talk about some quality improvements coming up. One of the biggest ways to look at your quality improvement is to look at your nurse utilization or your allied health utilization. And we look at that and we'd say, oh, look, looking at last week, this nurse actually had about 4.5 hours that their diary was open to see patients, that they had nothing in there. That's a pretty big clue, hey, where you could use your data to focus in on your quality improvement activities. Next up, and one we get asked about a lot, is how we look at our doctors. And we like to look at them by mapping them on an X and Y axis. On the X axis at the bottom, we have our billings per hour. And on the Y axis, we have our patients per hour. And suddenly we can get a really quick grasp of where all our doctors sit compared to our practice average of what are we billing per hour and what are our appointments per hour. If you've got doctors here in the bottom right-hand corner, I would say they're probably not engaging with your nurses around chronic disease management. And today we're talking about some quality improvements. So we're going to definitely be having a chat about chronic disease management. We're talking about chronic disease management, and we're nearly at the end of the key metrics to track. We love to overlay your appointment count and billings per appointment. There's a really interesting theory going around at the moment that if you keep adding appointments, you'll keep increasing revenue. Actually, what we're finding is if you keep adding appointments in the diary per hour, your billings per hour kind of stagnates, and if not decreases, because doctors start to bulk bill when they're running really late or they have to squeeze people in is a trend that we're noticing. So noticing that inflection point has been really interesting. Now, chronic disease management. So we talk about so much, and I know with COVID vaccine the last 2 years kind of got a bit off our radar. So we love to look at our CDM and what it was of our total billings and what it was in terms of the breakdown of items. Now, who's had a doctor who's worried about getting an audit if they do too much CDM? I know I've had to have them with my doctors. And everyone says, Chris, what's the magic number? Which means we won't get an audit. I don't know the magic number. All I know is that the government makes the chronic disease billing data available every month, about 4 months after it's happened. What we love to do, let's compare the practice as a whole, which is that first column here, with what the benchmark was. And that's really interesting to see if you're above or below what the average was. But then over here, here's each one of your doctors. Say this column here was Dr. Smith. Is there any point doing any work with Dr. Smith to try and get her chronic disease billings up, which is already so much above the threshold? Probably not. If anything, you're going to be getting your clinical director to check the notes and do a bit of an audit. But down here with some of your other doctors that are lower than the average, that's your opportunity to increase your chronic disease management. Now, we've been talking a lot about increasing performance. For all my sins, I'm a surveyor and I couldn't do a PracticeHub webinar without talking something to do with the standards. 3.1A, our practice plans and sets goals aimed at improving our services. And C, 3.1B, our practice evaluates its progress towards achieving its goals. It really, really makes me sad when I visit clinics and they're amazing clinics and they don't have a business plan and they don't have goals. They're amazing clinics doing amazing work, but they don't have a business plan and they don't have goals. You can make those goals really anything you want to achieve for your clinic. Those plans and set business goals can be really anything you want to achieve for your clinic. They actually say in the standards, quality improvement activities can include changes to the diary, could include responding to feedback, could include analysing your database. So what we have here is we've got now our data, which is our baseline. We've got a remit for accreditation to do quality improvement and improve our clinic. Let's now have a chat about how we can improve our clinic. I'm a general practice nerd and I love quality improvement cycles. So I'm going to talk you through some quality improvement cycles today. I'm a practice manager, business manager by trade. I'm not going to be talking about the clinical realities of some of these because I think we need to respect the clinical autonomy of our doctors. First one I love to look at is our DNA rate. We see on average a DNA rate between 2 and 5% across the country. This is an example of a practice that had quite a high DNA problem, but what we did is we took that data and we said, look, this clinic has an 8% no-show rate. Do we know last year that meant there was 4,261 appointments worth $257,000 that this clinic didn't do? And how much does that change the conversation from saying, we have an 8% DNA rate, people are like, oh, yeah, that's, not good, but yeah, that's, thanks, Chris, lovely to tell me. $257,000 of billings, everyone suddenly goes, well, we probably should be doing something about that. And it's quite amazing the power of data in what you can do. So what we do in Cubiko, and if you need some help with this, I know your PHNs have a lot of information around that. We then give you your PDSA because data without an outcome or something you can do about it is just a lovely report that can sit on the wall, filed away every year, so what? So 2 ways that you can help use data to reduce your no-shows. We love to look at everyone who's booked in today that hasn't confirmed their appointment. And we give you the probability of them not showing up. And so many clinics then call that person and say, are you coming in today? Yes, confirm they're coming in. But say there's someone who comes in every time, they've got a 0% chance of not showing up, save the phone call and don't do that. The other frequent way to do it is to look at your upcoming appointments that are booked with patients that are frequent no-showers. And in our clinic, we've made it that they can only book on the day appointments. So suddenly you get that down and you get that number down. And for your quality improvement, for your business goals, everything like that, you have evidence, you have a record, you can pop it into your quality improvements register, and you've increased your business outcomes. I'm a little bit lazy, so if I can tick off 3 things with one task, I'm going to take the win on that. The next one, let's have a look at allergies. Do a really similar thing. What we do is look at everyone coming in today, and we look at who doesn't have allergies recorded. So once again, we've got our data, we've got how we're going, and then we look at who's coming in today, so our nurses can grab those patients and record the allergies. There's been a lot of chat about the healthy heart checks lately. I know it was Heart Health Week 2 weeks ago. It's amazing when you show a clinic the value of the heart health checks that are in their database, what it can be done. And once again, another fabulous quality improvement one. For all the Cubiko customers out there, I've actually got a great little preview for you of the next quality improvement cycle, which is going to be coming online in the next fortnight in Cubiko, which is about identifying ethnicity and cultural background. We're going to do the same thing, but to help you do that, but also track it over time and let you set that goal so you can work towards that data cleanup point as well. So that's your quality improvements. I thought we might do some quick, easy wins in 5 minutes that I have left spare to quickly chat. Hey, it is phenomenal the number of appointments that slip through in both general and specialist practices without getting billed. I used to think when I managed my practice and before we had this piece of data, and Anna Maria, I'm wondering if you can see that or you've noticed that talking to clinics. Yeah, we bill everything. The diary's all colored, billed, paid, completed. We built this metric and we quickly found out that actually when things were double booked, when there was nursing home visits, you can see in this clinic, there was one day that they were down a few reception team members and suddenly things stopped getting billed. And that's work that's being done. And you're trying to retain your doctors. You don't want them thinking they're not getting paid enough in your clinic, they're not earning enough. You want to put through every billing possible to make sure they're getting that return and for you as a clinic as well. The other big thing that we've been seeing, and I've been having a lot of chats about lately, is transitioning from bulk billing to mixed or private billing. Now, it's a huge topic of conversation. I actually asked a clinic that had done this recently, did you make that a quality improvement? When you transitioned your clinic from bulk billing to mixed billing, did you do that as a quality improvement cycle? Did you do that as a business goal? And did you track the outcomes of that goal? And they said no. And I was like, why not? That is a fabulous use of something you want to do for your business also, that you can count as your quality improvement. So if you're hoeing and humming about doing that, we've done a lot of work with clinics on looking at what you lose in terms of bulk billing incentives, but what you'd make up for in terms of the gap. And that's a really powerful number when you start to quantify it, and can make it a bit easier to bring your doctors along for the journey with you as well. All right, who did a lot of work vaccinating patients last year in the COVID vaccine rollout? I know a lot of people did. Virtually, I don't know why I'm putting up my hand. I can't see you all, but I love it. I love putting up my hand. We did a lot of work with our clinical guidance group, and there's actually quite a strong correlation between patients that were eligible for the flu vaccine or the COVID vaccine. PS, talking about flu vaccine, heart goes out to all the Queensland practices on the call today. I know you're being smashed, so thank you for making time to be on the call today as you're trying to work out what we're going to do with the stock of private vaccines that we have in our fridges and how we're going to communicate this with patients. But back to COVID and flu vaccines, there's about a 98% correlation between eligibility and the opportunity to be on chronic disease management. And it's not going to give you patients that had asthma once 3 years ago that suddenly should be on a chronic disease management plan. It's going to give you a much tighter list of patients that we find doctors love to engage with because it's a much more targeted list to get them onto chronic disease. So look at the value of it in your database, look at how you have it in, and then we love to pair it with a list of who's coming in today and what those patients might be able to be given. So a lot of clinics with Cubiko, or a lot of really like clinics that like to write their own SQL queries, will give their doctor a list of opportunities for patients presenting today. And this is a great way to take data from being that reports that we were looking back on the stairs to putting it into action. Look at who's coming in today, give that list to your doctors, and we actually have a great handout for you. We use it in a lot of clinics that we support, and the doctor then ticks on a little cheat sheet, and there's a link here to download, but it's also going to be in the follow-up that comes out after this. We used to laminate them, and there were cards that the patient could take to reception that said, book in Mary for health assessment, or book in Mary for 721, 723. And I know you can put it in the notes at the end of the billings, but how much with a crazy reception desk does that often get billed? We used to do it laminated. In this crazy post-COVID world, we say do it individual sheets. And our reception team, we print them on orange paper, and our reception team know patient has orange paper, get tick sheet from them and book them in for something. I know I run a tech company and should have a beautiful technological solution. Paper works for that one. Paper works, and it can be really, really powerful. So one last thing, I'm nearly out of time, but I quickly wanted to show you something that we've seen some really great clinics do with their nursing. I love nurses. I think they're really key to what happens in general practice. I also think involving nurses with everything that's coming up in the 10-year primary healthcare reform strategy is going to be really, really critical. So look at your patients who are eligible for their 10997s and book them in by giving your nurse a list of who's coming in today and how you can engage with them. But the best way to get the team on board with looking ahead and booking them in is actually to do a historical audit. Is to look back and see everyone who's come into your clinic, seen a nurse, and was eligible to bill a 10997. Now, before you all typing stuff in chat and saying, Chris, we can't bill them all, totally. You need to do a chart audit and find out if they're eligible for the 10997s with the type of care that was provided in that appointment. But it's a great way to really sort of get the team saying, let's look back and bill everything we missed, and then look ahead and make sure we're taking advantage of all those opportunities. Now, teamwork is really important. And I've just spoken about the value of nurses, and we talked about utilization before. One of the metrics I love to look at is when is the busiest time in our clinic. Pre-COVID, I reckon all the practice managers out there could tell you that from the noise in the waiting room or how busy the corridors were. But now we have telehealth. We've actually lost that physical barometer of what's going on. So one of the most popular metrics we have at the moment is looking at the busiest time that our receptionists are booking in patients and our online engine of booking in patients, and overlaying that with the busiest time in the clinics. And it can give you some pretty amazing insights about how you should be rostering and how you should be making things happen. And suddenly data can make a whole lot more sense to use in your clinic. So I'm going to stop sharing now because I think that's a perfect segue to David to have a chat about people and rostering and everything to do with the mechanics of a clinic.
Thanks, Chris. I love your presentations, not only for the energy, but also the graphics as well. And I guess I'm here to balance that to some extent, because what we don't want is everyone to leave this chat with just a face full of graphs. And what Chris has done is powerfully show you the way in which data can be presented. And he's given you some insights into how to really usefully use that, particularly for those general practices out there that are working through quality improvement frameworks and looking at some of those metrics, or equally relevant to specialist practices as well, as I would say, although obviously not from an incentive payment point of view. What I want to take you through over the next 15 minutes is the way in which we would operationalize these pieces of data, and to give you some clues into how to make sense on a day-by-day basis from the information that comes through data analytics and the sort of interfaces that Cubiko do. What these tools do is actually give you access to high level and really important insights into the business that otherwise would take you days and days or weeks and weeks of spreadsheets to try and work out yourself. So the fact that this information is available through systems like Cubiko is just revolutionary and really changes the way in which the practice managers out there should think about managing their practices. But let's start with probably a question on some people's lips, and that is, what on earth do I do with all the information? And let's talk about staffing and rostering. So what you've just seen from Chris there is an analysis of how busy administration staff are with taking appointments. That's really important because that's time spent on the telephone and on the computer, and therefore it's not time spent dealing with the front of house activities like meeting and greeting patients necessarily, or taking payments. How do we distill that down to rostering? Well, I guess the biggest cost in any practice is going to be the cost of staff. And so actually understanding that cost and overlaying that with what the business has to do on any particular time during the day is a really important starting point. So not only would you use an understanding of the staff utilization as presented in that sort of graphic, but also there should be some sort of insight into the cost of staff at any time during the day. Now, there's various different tools, and we work closely with Tanda and use that as our payroll and rostering system. And Tanda integrates with Cubiko as well to give some of that information. Actually working out the dollar cost of staff per hour or even per minute, according to how it's spread out during the day, and then the staff utilization actually gives you real world figures about what it's costing you to produce that amount of work. So having that sort of metric day by day can give you information on rostering. Actually thinking about strategy, staff utilization, and also staffing levels, you should also cross-reference that with the amount of money that's coming through the practice at those hours. So, of course, the amount of patients coming through in the billing cycles or the billing activities of nurses and doctors during those hours should correlate with the amount of money spent on staffing. Simple metrics, relatively easy to track and quite easy to track with a tool like Cubiko, and actually gives you something to manage. And this is where I want to take that next step. As a practice manager or practice owner, how do you respond to that insight to data? If you're tracking the cost of staff per dollar earned through the practice, which is easily derived from these sort of metrics, you'd actually work around a benchmark and decide whether you don't have enough staff to provide the service or you're having too many staff to provide the service. Importantly, you can also track over time the impact of efficiency changes. So bringing in new software, changing telephone systems, changing orientation of staff or anything else around the practice. So what we recommend when we're consulting with practices improve their practice management is to pick some of those really key metrics. So for sure have access to all of the data that comes out of Cubiko, but actually decide on some of the specifics you're going to use to track to every week or every month in your management decisions. Now, staff per session or the number of staff per doctor or the cost of staff per patient, metrics that might make sense to you and certainly will make sense to different practices that we work with in terms of providing them a management strategy. If you're talking to consistent metrics, then you can track how things are going. One question that is often asked of me from practice managers that we're consulting with is how do you work out the cost of staff? How do you work out what they're spending their time doing? This is both a hard skill and a soft skill, but it's actually understanding a process that we would call a time cost analysis. So working with staff, watching, observing, understanding how they're doing things. And if that's not memorable, then I will tell you what it used to be consistently like maybe 5 years ago, walking to practices to do these consults, where we would frequently walk in and find a staff member printing a fax to a piece of paper, then picking that piece of paper up and going to the scanner and scanning it in. Now that is a complete waste of time. There's a technological solution for that. But if you weren't in the office seeing that actually happening, you might not understand that that's why it takes 4.5 minutes to deal with filing an email, when in fact, a half-hour consult with your IT department will be able to actually produce a 5-second turnaround for that activity. So time cost analysis is important to have a handle on, even with a stopwatch, even with counting the dollars as you go along. And that forms part of a workflow analysis. Now, PracticeHub is the repository of processes and procedures for many practices on the call. And if they're not on PracticeHub, they should be. But once you've mapped out your process and procedure, you should have some sort of idea about the time it takes for that and what sort of staff should be doing it, what else they can do at the same time. For example, can you run a process while you're on hold to Medicare, for example? Those sort of things should be known. So practice managers should have some sort of idea about how those workflows roll out. And then correlating that back to the cost of staff and the busiest times a day is the next and final step. And you can report that internally to the principals at the board meeting every month. Now, I haven't seen the questions in the chat. There'll be a question, I'm sure, that says, how many staff per doctor session should I have? That is an answer for you to come up with once you've had a look at those metrics we spoke about, the cost of staff, the busyness of the clinic, and what you get out of the staff in terms of efficient use of procedures. For specialists out there, if you have more than one staff member per 6 consulting sessions a week, you've got too many staff members. For general practices, obviously depends on how many allied healthcare staff and other activities you have. So I want to take that step back. So I'm not giving you an answer for the ratio of staff per session, but happy to talk about it down the track. But do your own numbers to work it out and find out where it's at and track that. I want to move on to incorporating KPIs and metrics into decision making. One of the beauties of having this data in hand is that you can now talk about it. It's now part of the language. Every single metric is not important to bring up in discussions, but there'll be a few key metrics that you need to identify as practice managers and practice owners that should be part of the conversation. For a practice manager speaking to admin staff, it may be responding to the weekly catch up with the team and talking about how you're tracking in terms of online bookings, in-person bookings, the turnaround times for bookings, wait lists, and that sort of stuff. A meeting with the practice manager and the directors or the practice principals should certainly look at the highlighted metrics that are important for your practice about efficiency, profitability, and quality of care metrics. These sort of things should be decided upon, but pick 4 or 5 that are relevant for your practice, relevant for the decision making, and then work out how to respond to those opportunities. And we've already seen a few good examples where opportunities equal, in many cases, hundreds of thousands of dollars. They may equal better staff engagement, may equal better outcomes for patients, or overall improvement across the practice. So I'd encourage people to identify their key KPIs. Don't worry about the list of 1,000 things Cubiko could do. Pick out the ones that it does do meaningful for your practice and align with that strategy we spoke about earlier that you're going to have for your practice. What is it that you need to achieve this year to improve the business? Is it?
Hey, David, I've got a great story around that. If you've got 2 seconds for me to tell. Yeah, we built Cubiko for the first 18 clinics with 100 metrics. And we're actually coming up on nearly 1,000 now. And the reason is not that 1,000 metrics are useful to every clinic, but each clinic has something different they wanted to focus in on, because we know every practice is different. And one of the most requested features that we built and released last year was the ability to build your own dashboard. So exactly what you said, as a group, sit down with your nurses, sit down with your admin team, and just put 2 or 3 things onto their personal favorites, and they don't need to see the rest. And that's been a really powerful tool to drive the stress just coming off the practice manager or the practice owner and sharing what's happening with everyone. So yeah, just a bit of an anecdote there.
I was actually going to throw to you with exactly that question. So thanks for bringing up.
But mate, read your mind.
It's powerful, isn't it, to have those management metrics part of the day-to-day conversation. So it's not about a performance review every 3 months. Oh my God, you haven't seen enough patients. It's actually, okay, how am I tracking? I can actually, as an employee or practitioner here, actually try and maintain my level of output or achieve my KPIs that the business has set for me.
Yeah, it was really interesting. We launched individual Dr Cubico last year that just shows the individual doctor their data, but the clinic gets to show whether they get to see their data versus the practice average or not. Because humans are a little bit inherently competitive, or many are. So having a goal or a target or to be, number 1 or 2 can actually really drive performance. But actually for our reception and nursing, the goal of 0 is very powerful. Because sometimes, I don't know about you, but in general practice, we're just getting smashed left and right, and smashed left and right. And governments are changing flu backs, COVID backs, and things like that. And having a goal or a target that our wonderful receptionist Wendy can work to be at no X of overdue recalls or no Y of this, gives them that endorphin hit of doing something well and reaching a goal or a target. Not just a smack all the time from patients and government and things like that. So we've found that to be really powerful.
And importantly, it gives them delegates responsibility. Say, look, I'm not meeting the metric because of this or that. Can I get some support? Can we change the process? Can we support the outcome that we're looking for here from a systems or management perspective? Like you say, it's broadening the practice management responsibilities across everyone and bringing them into the conversations.
Yeah.
But we make it sound so easy, and with our stories and experience, many aspects of it are. But I think one of the realities is that practice managers on this call and practice owners on the call say, well, that's fabulous and these insights are deeply encouraging, but I'm still going to have problems because I don't have enough staff, or we're so busy. We've got these goals we want to get to, not sure how we're doing it, or my practice manager hasn't got experience with this. How do we make those steps of improvement? And it's important to say that setting KPIs are part of a whole narrative here. We've heard about data collection and now some data interpretation, but the steps of moving past and getting benefits from the KPIs really come from building out that strategy and then doing little projects around some of the feedback. So if as a practice owner or manager, you're seeing that you're consistently not hitting your target, or you're below the benchmarks that Cubiko is starting to give us now, then there's a question is, what do you do? And where do you get expertise for that? The PHNs have been mentioned. In fact, I think there's even higher quality information that you can get from a practice management consultant that can be engaged from a project perspective to say, look, missing these metrics, we know we're missing this dollar value. Can we have some help in a project sense to come in, design a project that can be reviewed, again, using your data analytics, but be expected to succeed because we don't have the time to do it. So bringing an external expert for a single project, for example, give me that $257,000 back. How can I get it? Good, we'll spend $3 or $4 grand on a project manager to come in, set it up for the clinic, and then we're going to be all guns blazing without having to worry that we're overburdening staff that are already at maximum capacity. So one of the reasons that we get engaged frequently from people who use data analytics is with flagging that problem. We're down on our utilization, we're up on our costs, we're down on our conversion, we're down on our CDMs. We don't have we don't have a nurse workflow that's efficiently been able to fill those sessions, and just actually providing someone to spend that time can quite clearly, when you've got these trackable analytics, quite clearly deliver the dollar value back again. So I think a business review process when these flags come up is super important to make the most use of benchmarks and to feed back into your business operations systems quality improvements, particularly as well, making everyone happy. I was going to talk about strategy not being window dressing. I think we've emphasized that point enough, but really if you don't have a strategy, just sketch one out, build it out, iterate it over time, but have something to talk about in your meetings with practice principals and practice managers so you know that you're all heading in the same direction. Chris, I wanted to ask you, what's the best way that you've found to keep staff members engaged with data analytics? What's the secret sauce there?
Yeah, look, I'll tell you my learning. It's pretty brutal, but safe space to share here. When I started building metrics in my clinic, and I was an accountant and IT nerd who'd started running a general practice. I produced amazing graphs about billings per hour and appointments per hour and percentage CDM and everything like that. And everyone humored me and said, Chris, that's lovely. It's a beautiful picture. Yes, we know there's opportunity here. We know there's opportunity there. That's all lovely. And we're doing a lot of work with specialists in the Genie landscape at the moment, and we're finding the same thing. Everyone's like, amazing, you've given me the light on this, and we'll use this tool once a month or once a week to get those reports. But it wasn't until for each metric that had that report, we produced a metric that gave them something they could do, that people started engaging with data. I don't know about you guys, but we get a lovely PDF from our PHN every month that showed good, bad, smiley faces, red graphs. This is how you went. And our team would be, that's nice, let's put that on the shelf. Thank you for the graph. Suddenly, when we made data and insights that people could action, it went from being that's lovely to that makes my life easier, or that increases our patient care and our financial outcomes. And you find that metric that gets your team behind it. And for some of our clinics, that's been, here's the patients today who are eligible for the 75 plus health assessments. For some teams, it's been, oh, great, here's a list of all the 10997s I forgot to bill last month. For some teams, it's a list of patients who've got a high chance of not coming in. For other clinics, it's a forecast for the next 3 weeks about when they should be doing their Facebook or Google ads. And what it did is it took the data being off something that sat with the practice manager or the practice owner who produced beautiful reports and gave it around to everyone wanted to have part of it. And they knew that by using that, it saved them time or provided better patient outcomes. Data went from a nice thing to a core part of what happened. And that was sort of a hearts and minds moment that I think was really important.
Yeah, and so we've consulted in many, many practices, and our starting point is always, where can you bring everyone in the team along? Now, prior to Cubiko being around, most of the conversations about CDM or nurse utilization was with the practitioner or with the nurse, trying to wake them up, showing them how empty they were or how many numbers they hadn't hit. Actually, even before Cubiko, we would bring in the admin staff at the front desk, would bring in the practice manager and say, this is incentivized, this is paid for because it improves the health of the community. Now, you want to provide healthcare, we want to provide healthcare as a group, practitioners just as much as the admin staff. This is how we're going to do it. We're going to actually have that conversation and look for people that are, identify people who can benefit from some of the services we offer. Now Cubiko actually makes it easier. Now there's dashboards to actually have people engage with it. Now there's reasons why a team meeting every week or every month can actually bring up how we're doing as a group and track it. And that's just one example. If we're talking about efficiency, if we're talking about quality of care, if we're talking about support for the doctors or the patients or the local footy club, these things can be tracked in various different ways, but it should be from the whole of practice approach. Even to the cleaners, the cleaners should have some feedback on what the patient feedback's been for the waiting room when they get there in the morning, sort of thing. So there's someone that should not be engaged in delivering the quality of healthcare, and that actually, with metrics, that allows you to work towards something every individual can work towards an improvement.
Yeah. It's actually sharing the practice's vision and getting everyone on board with it, but then giving everyone something to own. That's actually right. Reduces the stress of the practice manager or the practice owner. So one fabulous example was a practice manager in one of our clinics used to sit there and go and check all the urgent recalls every week to make sure that it happened. And would sit there and count them all up and see what was there and on the urgent recalls and how many had been there. Because clinically, that's one of the biggest risks that we had as practice managers and practice owners. And suddenly, when you could get there in one spot and see what was happening, with a little data's view of your recalls, that time was no longer spent counting and doing that in Excel. They empowered their second 9 a.m. starting receptionist of the day to be the person that kept an eye on that list. And they freed up the practice manager and the practice owner to work on that really exciting stuff that on top of that can bring real value to the business. But they knew that the team had a tool to get there. And look, it doesn't have to be Cubiko. It could be a beautiful Excel spreadsheet, or it could be a piece of paper and some butcher's paper on the wall. But sharing what was happening suddenly got everyone involved. And it wasn't just the practice manager in their head at 2 a.m. trying to be like, I'm going to do that tomorrow and this tomorrow, and where's this at and what are we going to do here? Because everyone was involved in making better practice outcomes.
That's right. And these things should be systematized. These things, I like the idea of the butchered paper. I'd much rather see it in PracticeHub documented. Yep. So I guess the take home from this part of our chat, Anna Maria and Chris, is that I think individualising the metrics that we're tracking for team members in relevant ways, so they've got some input, so they've got ownership, and so they got some direction about improvement or maintaining standards. Really great way to get new staff on board. Really easy way to report on the performance of the clinic. And where there is a difficulty, I think, is finding space to spend the time on that quality step, that step of just lining things up. So I encourage all the people here that hopefully, I suspect everyone, if they're not Cubiko subscribers, they will be soon, apart from those few on Mediflex. I'll leave that for the commercial discussion later, but we've got to see the opportunities here, and the opportunities can definitely come through a rational approach to identifying the metrics that are good for an individual practice, setting them up, tracking them, and responding to them in the appropriate way. And that may be not a skill set that's internal in the practice. It may be a discussion with the accountant. It may be a discussion with the IT person or practice management advisor, but responding to them because you know the benefit it gives. You can track how much money it's going to save you or it's going to produce. And that's a really powerful way to manage a practice, in my view.
Yeah, mate, we've found that a lot of clinics will invite their advisors into Cubiko. Because it's web-based, you can invite whoever you want into it to look at your data, and you can actually choose what they see. So you can invite your accountant in just to see the financial tab, or invite your practice management consultant in to help with workflow and opportunity. And you know what? You don't have to spend 3 days making spreadsheets and getting data out and doing reports before the meeting. You actually get to engage around the good stuff, the doing, the improving, rather than the collating and the putting it all together. So yeah, a lot of clinics have been doing that and really controlling what people see to make sure they're in line with privacy obligations, but it's pretty powerful.
Can hand over to you, Anna Maria, to take some questions if you like.
Absolutely. Thank you both. That was just really fascinating. And I think probably one of the key things with all this data is it really helps identify what's important, doesn't it? I think there's, so much noise, so much busyness that we all work with, but this also helps to think about what is actually important. And Chris, I really like that comment about, your data, creating actions out of the data. It's like, this is all great, now what? But this means we do that. So I think that's really critical. Chris, I guess one question I had for you was around the Medicare sharing the data so you can compare, yourself against the average. Is that, you said that came out like every month or so?
Yeah, so Medicare, because it's a government department, they have to provide that data in the open data sharing mandate of the government. I think they just dropped February. So, they're a bit slow in releasing the data, but anyone can jump on. So they just dropped March. So we just put March on board in Cubiko recently. So what we do is we have people who are much cleverer than me and they can scrape that from the website. But if you go to the Medicare website, you can do those searches for the different item numbers. The interesting thing with it is you can't sort of compare counts. You have to compare ratios because we don't know how many hours people are working and everything like that in the Medicare data set. So the ratios that we love and we get a lot of awesome feedback are your A's, B's, C's, and D's, your telehealth to conventional, and then for your chronic disease. In the specialist landscape, it actually gets a bit easier because there's more of a limited set of item numbers normally, depending on the specialty that people are using. And once again, all those item numbers are available there. And you can do it by state as well. Although we don't see a huge fluctuation between states, the main times we saw fluctuation between states is actually when there was lockdowns and the amount of telehealth that was being used at those points. But that's open data there available as well.
Brilliant. Thank you. All right. I think we've covered most of the questions. You'll be delighted to see the comment our accountant goes through the financial data and highlights to us what needs improving. So that is basically in action exactly what you've been describing. So that's And David, I'm sure from your perspective, this is just such a bonus to have this information when you're working with practices as well.
I think Chris's point of not having to spend 3 days producing spreadsheets. Cubiko has done all the hard work. It's plugged in. We know that it gives quality information and really reliable, actionable points from practice management consultant to say, right, we don't have to ask any more questions just about. let's have a look at your strategy. Let's have a look at how we're going to deliver this level of improvement and work with the team there.
And one of the really interesting things on that, David, is when we built Cubiko the first time, what was the definition of an hour in a medical practice? Like, I had a definition of an hour, and the first beta clinic that we went to had a totally different definition of an hour. So is it just when you're with patients, or is it the whole time that was open up to see patients, and what do double bookings count like, and what the no-shows count like, things like that. So we actually sort of landed on 3 definitions of an hour, depending on what stage of a life cycle a clinic was in. But it's been really interesting then to see people go out and say, well, I'm billing $315 per hour, and then talk to someone who says, oh, well, I'm booking $240 per hour. I must be doing worse. And actually, they weren't doing worse. They actually just weren't using apples and apples. You know, how we actually talk about the definitions of this stuff becomes really important. And to your point there, you know, you want to get it the same way every time. You don't want that when the receptionist did it this month, they didn't include no-shows. The reception the next month when they did it, they did include no-shows. Because that gives you wildly different figures that suddenly your doctors don't engage with. You know, people are like, oh, that data's wrong, I'm not going to talk to you about it. And that's been a really powerful learning.
Excellent. All right. In the few minutes we have left, I would love to show you what PracticeHub can do and help in this area. And it's a slightly different, I think, you know, you've talked a lot about figures, I guess, and this is more from a sort of this qualitative side as well, not just the quantitative as well. So when I thought about this topic about practice data, some of the things that I thought would be useful to think about and to see, things around your compliance, your staff's compliance, and signing off with their policies and procedures. So one of the things that you can do within PracticeHub is you can assign a policy and procedure that by role, because I think it's important to be consistent by role. And so within our manual, we have our policy and procedure, but who needs to sign off on this? And we can do that electronically. So you can assign it to a user by their role, and they'll see this banner, they'll go in, I've read and understood and agree to comply. And I think that's really useful to have that information. And again, you know, you talked about the hours of collating reports. I always think of this as the hours that you spent handing out hard copies.
Oh, yeah.
That's what I always...
Yeah.
And then the task of then counting back. I gave out 20, I got 15 back, which 5 didn't come back, you know, and all that sort of thing. So again, this is kind of a case of how to make better use of your time, as well as minimizing the risk and having high quality processes in your practice. So again, they can click on confirm. And when it comes down to how do I know what's been signed off? Well, that's really simple. Show on policies, I can filter for them, and then I can go through and I can select, I can shrink my screen, I can select archived, and I can see really clearly under the status column, if it's ticked, it's a recent version. If it's got a cross, then it means there's a newer version that is waiting to be signed off. So that information is really helpful. And again, too, when you're having those discussions with your team, you can have a conversation that says, hey, on this date, you signed off on our social media policy, which says X, Y, and Z. And then I've noticed that perhaps, you know, you're not complying with that. So that information, I think, is really useful in terms of saving you time, but having good systems and processes to manage that as well. The other thing that we do have in PracticeHub, and yeah, I think of it as quite a simple process because I don't think some of these things need to be overcomplicated, but it is things around registers for your complaints, for your risk incidents, and then of course, quality improvement. Now, of course, Chris has talked a lot about, you know, quality improvement and all these actions that you take. And I think Chris, as an accreditor, you or an assessor, sorry, you would know how often you go in and everyone's madly put things in for the last 6 months in the run up to accreditation, and sadly not recognise that so many of the things that they've done well could be listed here. And I think gives the practice a sense of achievement too.
Yeah. Oh, look, I think one of the awesome practices I went to celebrated these wins with a pizza party. Now, I'm not condoning pizza parties as a healthy form of reward, but suddenly when you made it fun and you made it like, team, we want to get 10 things on the quality improvement register by the end of this year, everyone becomes really aware of it and they're working towards it, and it's fun and it's a goal, and it's like, make it part of it. And I love that because you can really see it when you visit a clinic and they've been putting everything in there. And it might be something really small, but hey, that's a win. And it might look small in your eyes, but to the person who did it or solved that problem, it could be something that stops them going to another clinic. Being acknowledged for that great work. We all know how hard recruitment and retention is at the moment. Yes. Acknowledging someone's fabulous work in that register is pretty powerful for them to feel acknowledged and heard, and a pretty important part of the team.
Definitely, definitely. One of the things we do have in PracticeHub in our resources, and some of you may know Angela Mason, who is a very, very, very skilled practice consultant originally and is now with the Avant team as a risk advisor. But when those PIP, the QI PIP enhancements or benefits came out, she went through and thought about what are some of the QI activities that you could do that would be useful to the practice. And I'll just quickly have a look through. Here we go. So we actually did ones. So these are sample ones that are really useful in terms of a project to decrease waiting times, having an effective recall system, and those sorts of things. So we even give you this sort of guidance on how to do these things, written by someone who understands your practice, how to run a practice, and that it makes it so much simpler to have that information. So a bit like a lot of the information, Chris, that you provide and those sort of templates, wherever they have templates, it makes such a difference for people when they don't feel they have to start from scratch. So again, for those of you that do have PracticeHub, if you haven't had a look at these, I highly recommend it. They're very useful as well to sort of have a look and see how they can support your activities. The other area I think is really useful from the point of view of information is from the point of, processes and systems for your team is around our training modules. So within the PracticeHub platform, we have 8 pre-configured training modules. And I think, again, this is one of those things that you can do as a team building exercise. And you can incorporate, how do we do things in our practice? How does it align with what we see in these learning modules? But basically using these as an opportunity for team building. And then ultimately, people are completing these courses, they get a certificate, and you can pull that data as well to sort of say, okay, part of our quality improvement practices is to do this regular ongoing training, and we can demonstrate that our team are doing these courses. And I always think people like to do these in some ways because it does give you, again, a sense of accomplishment and easy to do on site in the practice and that sort of thing. So once again, really simple to sort of go through and say, all right, show me who's completed. And I can see all the information, the courses that they've completed, and I can even download a certificate if I want to. And who doesn't love a certificate? Now, other things I think just in the last couple of minutes that we've got here that I wanted to show you were things like, when it comes to data, our credentialing applications. Now, I really like the APRA alerts one because I think, again, it's one of those areas where you can spend time checking, following up, that sort of thing with your team, all your APRA registered practitioners, doctors, nurses, and so on. But if they're in the PracticeHub platform with their APRA details, you get a daily check against the APRA website or the APRA database if anything has changed with their registration status. So those of you with PracticeHub with nursing staff coming up to the 31st of May, keep an eye out on your alerts, on your dashboard for the APRA alerts, because that will flag if any of your nurses have forgotten to renew their registration or something has happened. But this is the time of the year. I always think, depending on what kind of practice you're in, but certainly most healthcare practices, May and September are the 2 times where these applications or this application.
Just so flu season time, just when we're busy doing everything else, this is fabulous to save that heartache to do something else in the middle of flu vaccines and flu season.
Exactly. So that's that one. I think probably conscious of time, if you want to know more about PracticeHub, you should definitely contact us. But let me go back to my screen. That was a very quick overview. So just quickly, some next steps. If you're already a PracticeHub customer and you would like to know more information, follow up on some of the things we've talked about today, please give us a call. If you're not a PracticeHub customer, please visit our website and you can book a one-to-one demonstration with one of our consultants who will talk to you about how PracticeHub can work in your practice. Please visit our website for articles and recordings of other webinars and Facebook Live events that we do. And we're also reachable via our live chat from 9 till 5 Australian Eastern Standard Time. Lastly, don't forget to register for our upcoming webinars. Next month is a really good one. It's on Thursday, the 16th of June, and we'll be talking about consumables and the NBS and optimizing your patient care. So I know that sometimes I see in a lot of the forums that people often have these sort of question marks around consumables in particular. Everybody wants to be doing the right thing, but it's somewhat of a mystery. So please register for that one. And in closing, can I thank Chris and David for exceptional presentations as always, and very insightful.
Thanks very much.
Thank you.
How fantastic it is that we get to talk about the tools that make practice management easy, because it's not easy, but with these things, you've actually got some real hefty tools that do a fair bit of the heavy lifting in a practice, and fantastic to share it with you guys.
And I've just lived my PracticeHub customer coming on to be in a webinar, circle of life moment here. So, thank you for having me on today. It's pretty amazing.
Fantastic. All right. Thank you both. Thank you everyone for attending, and we look forward to seeing you next time.
See you later.